Today, we're going to be looking at bronchoscopy. Imagine being able to spot a minute foreign object lodged in an airway or detect a small lesion very early, all because you understood the importance of this procedure and advocated for your patient. That's the immense potential you wield as a nurse. So today, we're going to unpack what a bronchoscopy is, why we perform it, and talk about your vital role during the procedure, as well as how to interpret the findings and what potential complications to be on the lookout for. Here's our objectives. I want you to understand the purpose and indications for a bronchoscopy, identify necessary nursing interventions before, during, and after a bronchoscopy, understand the importance of client education regarding bronchoscopy, learn how to interpret the findings from a bronchoscopy, and recognize potential complications of bronchoscopy and corresponding nursing interventions. Let's get down to the nitty-gritty of what a bronchoscopy is all about. Now, it's going to give us a way to explore the larynx, the trachea, and the bronchi. The bronchoscope can come in two forms: a flexible fiber optic bronchoscope or a rigid bronchoscope. Each has its purpose and usage, but today let's think about them as just a way to get to where we need to go. Now, the bronchoscopy can be done in various settings. We might be in an outpatient clinic or a surgical suite under general anesthesia. We might even be at the patient's bedside with local anesthesia and moderate sedation, providing comfort for our patient. Imagine a patient on mechanical ventilation. Well, we can insert the scope right through their endotracheal tube. So you see, bronchoscopy is not just a procedure. It's a testament to our relentless quest to improve patient care. Now, bronchoscopy isn't just a sightseeing tour of the respiratory system. It's going to help us to investigate and tackle lots of different health challenges our patients might be facing. Let's say we have a patient who's had a persistent cough for a couple weeks and some abnormalities on their chest x-ray. A bronchoscopy can help you peer inside their respiratory tract. You might discover a tumor, inflammation, strictures, or a foreign object. Suddenly, you're not just treating symptoms, you're looking at the root cause. If you suspect lung cancer during a bronchoscopy, you can also obtain a biopsy of suspicious tissue. Okay, now yes, that will add risks of bleeding or perforation, but we can manage those with the right nursing interventions. What about our patients who have pneumonia or lung abscesses? A bronchoscopy can aspirate deep sputum for culture and sensitivity testing or cytology. A bronchoscope can even remove foreign bodies and secretions from the tracheobronchial tree, treat postoperative atelectasis, or even destroy and excise lesions. So it's kind of like a Swiss Army knife in our nursing toolkit. It serves multiple purposes and, when used wisely, can significantly impact patient outcomes. As you continue your journey to becoming nurses, remember the power of this tool and the immense difference you can make in your patients' lives. Let's keep moving forward. Our role in preparing our patients for bronchoscopy is important. It's not just the care we provide during the procedure, it's also the steps we take before to ensure everything runs smoothly. So, first, we need to know our patient inside out. We have to assess for allergies to anesthetic agents or if they're routinely using anticoagulants. Any adverse reactions can complicate the procedure, so it's essential to know these things beforehand. We need to make sure that the consent form has been signed by the client before the procedure. Remember, you don't do the discussion that gives them informed consent. That is the provider. But you do need to make sure that consent form has been signed and they have agreed to the procedure, because that's a key part of patient rights and ethical care. Now, if the client has dentures, we need to remove them before the procedure. We do not want any unwanted complications. Food and drinks? Nope. We have to maintain the client on NPO status, usually 4 to 8 hours prior to the procedure. This reduces the risk of aspiration when the cough reflex is blocked by anesthesia. And last but not least, let's talk about pre-procedure medications. Anxiolytics can help the client relax. Atropine may be used to decrease secretions. Viscous lidocaine or local anesthetic throat spray can numb the throat, and this reduces discomfort during the procedure. So these are the steps you'll need to take to make sure your patients are ready for their bronchoscopy. Now, during the procedure, we're going to position the client in a sitting or supine position, and this depends on the provider's preference and the client's comfort. It's not all about comfort, though. Proper positioning is crucial for allowing the bronchoscope to be inserted and maneuvered effectively. Now remember, as nurses, we also play a role in collecting and labeling specimens. This is a vital task and it requires your utmost attention. Incorrectly labeled specimens lead to misdiagnosis, so be sure to double check those labels. Remember, samples should be promptly delivered to the lab for analysis. The quicker the analysis, the quicker the results, and the quicker the appropriate care can be provided. Let's talk about monitoring. Keep a close eye on your client's vital signs, respiratory patterns, and oxygenation status throughout the procedure. Your meticulous observation can help detect any early signs of complications, and that lets you to immediately intervene. Okay, here's a critical point to remember. Sedation given to older adult clients who have respiratory insufficiency can precipitate respiratory arrest. We must monitor these patients closely and intervene immediately if their respiratory status declines. There you have it. The main nursing responsibilities during a bronchoscopy. It's all about vigilance, accuracy, and timeliness. Remember, your actions during these critical moments can significantly impact the outcomes for your patients. Keep practicing, keep learning, and always strive to be the best nurse you can be. Now the procedure's over, we're going to have to use our observation and nursing instincts. We have to get into post-procedure nursing interventions. We need to monitor the client's respirations, blood pressure, pulse oximetry, heart rate, and level of consciousness during the recovery period. These are the important vital signs. They can indicate how well the client is recovering. Be particularly alert with older adult clients, as they can develop confusion or lethargy due to the effects of medications given during the bronchoscopy. It's like being the detective of the recovery room, watching out for those subtle clues. Now, before we start any oral intake, we need to check for the presence of the gag reflex and the client's ability to swallow. This is crucial. We don't want to risk aspiration. Remember, the gag reflex in older adult clients can be slower to return due to impaired laryngeal reflex. So we start small with ice chips, then fluids once we're sure the gag reflex is back in action. But that's not all. We also need to monitor for signs of complications such as significant fever, productive cough, or hemoptysis indicative of hemorrhage. Yes, a small amount of blood-tinged sputum is expected. Anything more than that, though, we need to be ready to intervene. Don't forget about oral hygiene. It's essential to provide oral hygiene post-procedure to ensure the client's comfort and reduce the risk of infection. For our older clients, remember, encourage cough and deep breathing every 2 hours. This is crucial to prevent respiratory infections, which can be more severe and last longer in this population due to decreased cough effectiveness and secretion clearance. Remember, the client is not discharged from the recovery room until an adequate cough reflex and respiratory effort are present. So those are the key post-procedure nursing interventions for bronchoscopy. Now let's talk about a part of nursing that often gets overlooked, but it's just as important, and that's the client education. We're not just caregivers, we're teachers too. So let's talk about what we need to teach our patients about bronchoscopy. We need to explain the procedure in simple, understandable language. They're probably scared and anxious. It's our job to alleviate those fears by providing clear, accurate information. We should explain that it's a procedure that allows the doctor to examine the lungs and airways. It's not a surgery, but there might be a biopsy taken. They may be sedated to make them comfortable. We need to explain why the procedure is being done, whether we're diagnosing a condition or having therapeutic reasons. We need to reassure the client this procedure is essential to manage their health. We also need to talk about what to expect before, during, and after the procedure. Let them know about being MPO for a few hours before the procedure, the positioning during the procedure, and the recovery period. It's also important to discuss potential risks and complications such as bleeding, infection, or changes in voice. Remember, informed clients are empowered clients. Lastly, encourage questions. This isn't a monologue, it's a conversation. We should make sure our clients feel comfortable asking questions and voicing their concerns. Client education is all about communication, empathy, and respect. Now that we've discussed the procedure and how to prepare our patients, let's turn our attention to the critical task of interpreting the findings. Findings from a bronchoscopy can reveal a lot about a patient's respiratory health. We can see normal anatomy or uncover a whole range of conditions. These might include inflammation, tumors, strictures, or foreign bodies in the airway. If a biopsy was done, we might get insights into conditions like lung cancer. So, if the bronchoscope reveals an abnormal growth or lesion, we might have the presence of a tumor. But if we see inflammation or narrowing of the airways, this could be a sign of conditions like asthma or chronic bronchitis. It's important to consider the patient's history and symptoms. For example, that patient who's had the cough for 2 weeks, If the bronchoscopy reveals a foreign body in the airway, well, we can put two and two together. It's not always straightforward, though. Sometimes the findings can be ambiguous or unclear, and this is where your critical thinking skills come into play. You'll need to collaborate with the healthcare team, consider what your other diagnostic tests are telling you, and always keep the patient's overall health and well being in mind. Remember, as nurses, our role goes beyond just reading test results. We're part of the team that interprets these results, implements appropriate interventions, and advocates for our patients. So keep honing those analytical skills. They will serve you well. Now let's look at the potential complications and nursing interventions. As nurses, it's our responsibility to monitor our patients closely to catch any signs of complications early and intervene effectively. Let's dive in. One possible complication is laryngospasm. It's a fancy sounding term, but it just means uncontrolled muscle contractions of the vocal cords. These spasms can impede the patient's ability to inhale. It's like trying to breathe through one of those tiny coffee straws. I'm sure we can all agree that's not fun. So, as nurses, we need to continuously monitor for signs of respiratory distress, like stridor, cyanosis, or decreased oxygen saturation. Another potential complication is pneumothorax, which can occur following a rigid bronchoscope. A pneumothorax is when air collects in the pleural space, causing a lung to collapse. As nurses, we need to be vigilant in assessing breath sounds and oxygen saturation. Obtain a follow-up chest x-ray if we have any questions about the integrity of the lung. Aspiration is a risk if the patient chokes on oral or gastric secretions. To prevent this, withhold oral fluids or food until that gag reflex returns. Usually it's back within about 2 hours after the procedure. Suctioning may be performed as needed to clear the airways. Remember, your ability to quickly recognize and effectively respond to those complications can make a world of difference in your patient's outcomes. Finally, we've reached the end of the journey. We've navigated the whys and hows of bronchoscopy, looked at the nursing interventions at each stage of the procedure, explored the potential complications and our nursing responses. It's important to remember that while bronchoscopy is a common procedure, our role as nurses is anything but routine. We are the front line in patient care and safety. The work we do is crucial. I can't emphasize enough how critical it is for you to understand these procedures, indications, nursing interventions, and potential complications.